So welcome to another big dose of science. And boy, we really have a big dose for you here today because we have some special guests. First of all, let's welcome our new arrival. Emily is with us. She's not the new arrival. She, of course, is always with us. But she's going to do a little bit of show and tell, because something has happened since Emily was on with us a couple of weeks ago. Emily, all yours. Let's see.
I'm not sure if she's here yet, but she has separated herself from some.
Oh, there we
go. There's Emily.
We got a substitute for Emily. All right. That's Adam. That's Emily's husband, who is going to do the show and tell. So there's little Zoe. Who was
Here we
born,
have baby Zoe, and Mama is right behind me, coming any second now.
Oh my God!
I hope she's ready for prime time cameras. There we go. Hello.
Hello. Hello. So wait, hold on. Well, I'm on camera, but you could see her face here. So cute. Zoe Allen Rose Gold.
So Zoe was born, 3 days ago?
She was born, this is her 6th day of life. So she was born Wednesday, April 7th, 10:59 p.m. She was born 7 pounds, 4 ounces. But since then, because we're starting to learn how infants work, she probably was a little over, not just like over in her weight, because since then she was swallowed some amniotic fluid, we think, and now we're trying to get her back up there. So this is a really big learning curve, but it's awesome. And every 24 hours, things change.
Anyway,
as I'm sure Ceedie and Lisa both know very well.
You'll be able to tell her in years to come that her first appearance was on a science program.
That is very true. Yes, and now we can have this video forever.
Yes.
Yeah. So that's it.
And she's nice and quiet. She
is nice and she's a pretty sleepy baby. So we're waking her up to feed. So
very good. It's
interesting. Yeah.
All right.
I look forward to watching this this episode and hearing what's happening in Israel and everything for sure.
Okay. Very good.
Bye.
Congratulations.
Bye.
Thank you. Bye, guys. Bye.
All right. With us today, our usual crew, Ada McQueen and Jonathan Jerry. And also from Israel today, Dr. David Zlotnick, who was advertised that he was going to be on with us, but he had a little bit of traffic problems. So we were contemplating having a pinch hitter, my daughter Lisa, who is there. But David did make it, but we're going to keep Lisa on here for a little bit because she can also do some commentary. Lisa is also a McGill graduate in first bachelor's in, what was it, physiology?
Physical therapy.
Physical therapy, of course, physical therapy. Then she worked as a physical therapist. Then she did medical school. She got a medical degree. She doesn't practice, but she has good knowledge. And she's also into teaching yoga. So there's a lot of stuff there on which she can comment. And just before we started, we were chatting with Ada about the possibility of these menstrual irregularities that Dr. Jen Gunter, who was really very well known to the internet crowd, and she apparently said something about it. And we've been hearing about this, and Lisa alerted me to this morning. So Lisa, if you want to just very quickly encapsulate what you've been hearing.
Well, I can just say that anecdotally speaking, among a lot the women in our community, there's been a lot of talk about this. It's hard to know what to make of it, right? Because it's just, people talking, telling what's going on. But we've been hearing a lot of my friends, a lot of my neighbors. People are saying that after the vaccine, they've had these strange things happening in their cycles, and it kind of freaks people out, whether there is any actual association between the vaccine and whatever it is that's going on, but it makes people nervous, and especially people who may not have great science backgrounds. It gets people very worked up. So I'd be interested to follow up and hear what if anything?
Yeah, it is interesting, and I asked two Montreal gynecologists about this today, and they haven't heard anything. So it doesn't seem to be going around here yet. But of course, it's certainly conceivable that stress will have some sort of an effect. So if people start believing it, I don't know. I mean, Cede, do you think that there could be anything to it?
I mean, it's hard to know. When I first heard it, I was a bit skeptical about it being caused by the vaccine. I actually said the same thing about the stress initially when we first heard about it. But it seems to be, at least anecdotally at this point, that there might be more to it than that. And I didn't yet have a chance to see with Dr. Gunter what she mentioned about it. If there's anything more that they found.
Yeah, we'll look into it further. I mean, it's interesting when stories like this start to spread and pick up steam.
It's the idea that this might be stress related. Actually, when you mention that to people around here, people don't like to hear that because, to be honest, people around here have lived through and live with a far greater amount of stress than what COVID and this vaccine is causing. So I don't know, that seems like an unlikely,
Right.
a really unlikely reason.
I think
if it was being caused by stress, why would we only see it now with the vaccination? We've been stressed at least since the pandemic began.
Right.
And I was thinking about, that it sort of plays into this fear that, Jonathan and me mentioned that in your own podcast about the fear of the fertility issues with this misconception that it might cause fertility issues. So, those two things are obviously very separate, but I think that should be explained, that if people are having menstrual issues, it doesn't mean you're having, necessarily any long-term fertility issues. And that should be probably mentioned because there was that initial fear and sort of pseudoscience going on about that initially with the vaccine.
Now, you guys are more or less getting back to normal, right? I mean, essentially the vaccination is working, right? I mean,
Yeah, I looked at the numbers before, and I think we're at now about 60% of the population has gotten fully vaccinated in the country. And
what are you seeing in hospitalizations?
Hospitalizations have gone down. Basically all the major wards are closed. The COVID wards, it's quite interesting to think that around the sort of October time, we were seeing about 10,000 cases a day. And at one point up to close to 11,000. And you look at the last week and we're down to anywhere between about 200, 250. One day there was like 100 cases in the whole country.
Yeah, that's a lot better than what we're seeing here.
Do you guys want to reopen your COVID wards for Canadian and American patients maybe? Because I'm sure our healthcare workers would appreciate that.
No flights apparently available.
Well, anyway, this morning, of course, we had this news about the Johnson & Johnson vaccine causing blood clots. Now, the incidence...
Well, we can't say causing yet, Joe. Let's be careful.
Remarkably low, the incidence. I mean, we're talking about 6 cases out of 7 million vaccinations. Extremely low. And, this brings up sort of the interesting ethical question of stopping the Johnson & Johnson vaccine as they have done, putting a moratorium on it until they can figure out whether this is a cause and effect relationship. But what about the people who are going to get COVID and have serious consequences because they're not getting the vaccine? This is something that is hard to grapple with when it comes to the general public, because people say, well, maybe there is this problem here, we better stop until we figure it out. Well, Jonathan, I mean, you look into these things all the time, the epidemiology and the statistics. I mean, it's the old story is you don't stop cars from being manufactured because there are some car accidents.
Yeah, I mean, the human brain is really bad at assessing risks. And it's something that people like epidemiologists have to really train to learn how to do more objectively, because our brain is just not intuitively very good at this. And, to speak to what's happening with Johnson & Johnson's vaccine, which, again, these rare cases may or may not be linked to the vaccine. And we see this a similar situation with AstraZeneca's COVID vaccine. These regulatory health agencies are kind of stuck in an impossible situation, because if they just ignore these very rare cases and they say, oh, don't worry, the vaccine is fine, they'll be accused of a cover-up, of not taking people's health seriously enough, which will bring trust in these vaccines down. But if they do take them seriously and they say, okay, well, we need to stop and we need to really look at the data, that will also bring down trust in these vaccines, because all of a sudden people are panicking, going, oh my God, these things are causing, very dangerous blood clots. So it's a very crappy place to be, because the issue is that these vaccines are associated with these very rare cases. We don't yet know what is happening. And so whatever you do, however you play this, trust in these vaccines is going to go down.
In Israel, you have much less hesitancy about the vaccines, right?
I mean, I think in general, there's always some level of hesitancy. And I think, Lisa just mentioned to me a week ago that she bumped into some people here that did not want to take the vaccine. And you'll certainly will find that. But I found overall, I think the drive in the country went quite well. And, the fact that 60% of the population has taken 2 doses. Again, we have a large, young population in this country compared to Canada. Much younger population. So again, we're only giving above age 16. So a much larger part of the population in Israel is under age 16 compared to Canada, which is why those numbers are like that. So you'll always have some, but I actually thought there'd be more. And people who were initially skeptical. You've seen them now come around and take the vaccine. I'm not sure if that's because they have so many people around them getting it and everything was okay, or as opposed to just that the country's only allowing you to have the green passport. It's called the vaccination passport. So to go into a restaurant or to go into not the movie theaters yet, they're opening, but to go into other cultural events, you need to show your passport. So
is this actually happening? The green passport?
Yeah, yesterday I went. I was at work in Tel Aviv, and I had to go to a meeting outside. And they reserved in a restaurant, and you had to show your driver's license or some ID and your passport to get in. Yeah.
And if you don't have it, you can't go in?
Nope. You can sit outside. There's outdoor seatings, but for the indoor seating, you need to show your passport. So most places have the outdoor seating.
Yeah, I think this is not going to go over in the U.S. It's just...
No, probably not. Probably not.
Another interesting stat that I just saw in the U.S., I mean, it's quite frightening. 40% of the military, and of course, military is a lot of people in the U.S., 40% of the military have refused to take the vaccine. That's 40%.
And the flip side is that over here, I think they said the Army was actually the first population to achieve herd immunity.
Yeah.
Huh.
Yeah. It was very,
Yeah, I find that really surprising, because you would think that especially the military, they would do what they're told to do by higher authorities, but apparently that's just not happening.
Very shocking. I was going to go back to the clot for a second, just because I thought it was interesting. As a doctor and as an emergency doctor, you see patients with COVID or post-COVID, coming in with clots. Like COVID itself causes, clotting. We've seen pulmonary emboli and people coming in with these kind of things after. So, we're talking about the risks of a vaccine with a super low risk of clotting. I saw like an infographic about the risk of clotting in like smoking or, taking a contraceptive pill or having COVID versus the vaccine. So again, that goes to what Jonathan was saying about the, people being poor at assessing risk, but just COVID itself is can make you in a hypercoagulable state.
Well, this is what I was saying before is that, if a couple of 100,000 people are not going to be vaccinated now, who were due to be vaccinated by the Johnson & Johnson, how many of those are going to get COVID and get blood clots because of the COVID, right? And you can't really calculate this, and people just don't look at it in that kind of a way.
Yeah, because a lot of people will think, well, I don't know that I'll get COVID, so I don't know that I'll get the risks associated with COVID. But if I get the vaccine, it's me choosing to get the vaccine, and then if there's a risk associated with that, that's more of a certainty. So that's how a lot of people, unfortunately, do this kind of counseling.
Certainty, unfortunately, in science is very elusive, right?
Yeah.
Except I found one today. This is really interesting, where we can say something for certain. There's this circulating email that has been going around about the 1947 UFO crash in
Roswell?
In Roswell, New Mexico. and that within 10 months of that UFO crash, there were 10 prominent American politicians, Democratic politicians born. So, of course, the suggestion is that somehow aliens impregnated humans,
Right.
and that they did list, all the people, both Clintons, Nancy Pelosi, Kerry,
All the baby
they list
leaders.
10 prominent Democrats who they say were born within 10 months of the Roswell crash. The nice thing is that they submitted this to Snopes, which is, a wonderful website. They checked that out. And it turns out that it just isn't true. They checked when these people were born. Nancy Pelosi, for example, was born in 1940. She wasn't born in 1948. And the same thing for the others. So here's something that you can just dismiss based upon the facts. But this is so rare that you can do something like this in science, where you just say no.
If you lie about people's birth dates, that's very easy to check.
That's right.
If it was both Clintons, wouldn't that make them related? If they both came from the same alien and then they married each other, I don't know.
Right. Yeah. I think there are such ethical issues there. Okay, Lisa, with your yoga that you're doing, you think it has any effect on reducing people's stress?
On reducing people's stress, I think so. And I think actually even more so in the past several weeks to month that we started to go back to a more normal kind of existence. I actually find that what has given people a lot of relief is actually going back to in-person classes. People, the whole fitness yoga world has kind of moved online over the past year. People doing YouTube classes, Zoom classes, but I think I've seen people are just so desperate to have contact with other human beings that people are really benefiting from going back to in-person classes, which we've started to do.
But there's one type of exercise that is much better when it's done remotely, and that's Zumba. It's in the name. Right there in the name.
Well, talking
Bad joke number one.
Stress reduction. I was just looking at a study on music therapy. Very, very interesting. That they're doing this in hospitals. There's this lady who started this movement. She's a harpist, and they have harpists. I guess you call them harpists, right? People who play the harp.
You don't call them harpies, that's for sure.
Yeah, at the entrance to hospitals, because apparently that is a very stressful time when you go into the hospital. And so they have people there playing the harp, and this has led to a much more relaxing atmosphere. People are less likely to be aggressive, with the nurses. They're much more accepting of everything when you have the harp playing in the background. And they also said that in patients who are waiting for surgery, if they listen to calming music, it is as effective as the anti-anxiety meds that they usually give before surgery. So, and number of hospitals now are instituting this, and they're having live orchestras in the hospital. At first you would think, how can that possibly have a significant effect? But they say that it really does. And there actually are a surprising number of studies, when you start looking at the scientific literature on the value of music and what it can have on reducing the effect it can have, lowering blood pressure, lowering heart rate. And so, Sadie, what do you think of having someone at the Terem clinics, or at least piping in harp music so that you sedate the people before you treat them?
you may have to also have a coffee stand or in case the doctor they don't want to make you too relaxed. But I can totally see that. I think we should maybe think about moving it into airports. I know it's a very stressful, it could be aggressive environment now. So we can move them at the,
Or a harpist in every doctor's office. So you have your consult with your doctor, and there's a harpist present in the room.
So Jonathan, you were going to talk something about Reiki, which is kind of related to the stress relief business.
Yeah, very much so. I was interviewed by a journalist about this phenomenon that has happened during COVID. So of course there's a branch of alternative healing called energy healing or energy medicine in very large quotation marks. And Reiki is one of the main ones there, which was that about 100 years ago, there was a Japanese man who was interested in discovering psychic powers, who went on top of a mountain, starved himself for 21 days and had a hallucination and decided that he could channel, divine energy through his body. And that somehow has been taken up by a lot of people. They believe in this. They believe that we have these energy fields around us and that Reiki practitioners can detect these fields and they can manipulate them or infuse them with divine energy to promote healing. And so you can go and have like a Reiki session, like pre-pandemic, you could go to somebody's office and you would be lying down and they would be hovering their hands above your body, or sometimes they would actually touch your body in certain places to essentially sort of fix your aura, if you will. But now, because of COVID, there are Reiki practitioners who have taken to Zoom. And so now they are doing their Reiki sessions at a distance via Zoom. And I was being asked by this journalist, like, what do you make of all this? And of course, I think it is important to mention that these kinds of sessions, like putting aside the energy baggage that is very unscientific, obviously it can be very relaxing, and it can help you sort of de-stress. But I was reading about some of these Zoom sessions because some bloggers have underwent these little therapies and they've written about their experiences. And it's very funny because what often happens is that you have your Zoom appointment with the Reiki practitioner. They tell you to lie down for 45 minutes and sort of focus on your breath and relax. They're sending you energy via space. And then at the end of the 45 minutes, they text you to tell you that your session is over, and you come back to the Zoom and then you give that therapist your money. So it's a great gig if you can get it, because you don't have, as a therapist, you have to do nothing. Your clients just relax on their own, and then you collect their money. I think it's a great gig.
Everything old comes around again. I mean, this distance healing goes back to Edgar Cayce, and when they would do it either through the telephone or through mail, actually
right,
through snail mail, and this goes back to the 1930s and the 1940s when
it's alive and well.
When this was done. Now, of course, it's done in a much more technological fashion.
Yeah.
But because of there's a very strong connection between the body and the mind, there's no question that some of these people will feel better because there's probably nothing wrong with them in the first place.
Yeah, and just, I mean, if you've been stressed out by the pandemic and your work and all these things, and all of a sudden you are taking an hour to just relax and lie down and think of nothing, and you've got some nice music playing. I mean, of course, you're taking a moment for yourself. I just don't understand why you would give somebody else money for the privilege of taking time for yourself.
Because if you don't pay for it, it can't possibly be good.
I guess.
But, this is the one thing that these people have that physicians don't have is the time.
Yeah.
Right? I mean, like, CD, what's the average amount of time that a family practitioner spends with a patient?
That's a good question. I think that very much depends on country and locale. I know, for example, here in Israel, I think last time I read the study about that actually, and the average time spent in the family doctor was probably a bit under 10 minutes.
Right. So, when you take a look at the naturopaths and the homeopaths and the Reiki practitioners, all of these, they'll spend an hour with a patient, right? They will take this elaborate medical history, asking about every aspect of your life. And there's someone then who really cares about you, right? Because they're questioning everything. And very often that's all people need is they need their souls to be soothed.
I think there's also a, you know, like I know you've mentioned this in the past, a selection bias to what they're treating. I mean, if they're usually treating conditions that on their own will wax and wane, and things that have, you know, sort of, you know, flares up and then go get better on their own, no matter what you do. And
Sure.
those are the often, you know, the people who are coming. You know, no one's going to go to a Reiki practitioner for a, you know, acute heart attack or, you know, or a stroke.
One hopes. One hopes.
One hopes. So you know, it's also, you know, looking at the population that's going to those practitioners and what they're being treated for.
And there's also the self-delusion in that you hear back from the patients who feel better, but you don't hear back from the ones who don't. So I think that a lot of these quote alternative healers are really convinced that they're doing something good and that what they're doing is working. You know, and that's quite aside from the out and out charlatans, you know, who basically know that what they're peddling is just crap and they're doing it for money. And it's easy to become self-delusional, you know, when you hear back all of these compliments about how well everything has worked, even though all you've done is given them nothing but a water soaked into a sugar pill.
Yeah, it's like when I looked into, I believe it was cranial osteopathy, where the practitioners think that they can feel pulses of a weird energy in your skull by touching at certain places. And there were these very, very admittedly small studies that were done with different practitioners asking, like, you know, can you measure the pulse of this pulse, this energy pulsating that you supposedly can feel with your hands? And different practitioners found different pulses on the exact same people, right? So they were feeling something. It might have been the person's blood pulse. It might have been completely imaginary. It might have been the practitioner's own pulse at their fingertips, whatever it was. And they thought that it was this thing, this energy that does not actually exist. So it's very easy to fool yourself.
Yeah, especially when whatever is being done is somewhat invasive, like with acupuncture. You know, it somehow makes sense that you're putting needles into the body that can trigger something, right? And I've had all kinds of conversations with people who will swear that you know, acupuncture works for them, and yet we have all of these studies with the sham acupuncture where the needle actually retracts into the head that shows that it just doesn't do anything. But someone who has been helped by acupuncture will never be convinced that happened due to chance alone. Oh.
Yeah, I mean, we are always looking for something to blame, but we're also looking for an explanation for something that happened. And when you have a correlation like this, it's very hard to convince yourself that it's not causative, that it's not, this thing was caused by that. So, you know, it happened after the intervention, therefore it must be because of the intervention, and you become a believer.
Right.
That actually makes me think of the COVID-19 vaccines and the menstrual issues, because that in of itself is kind of a regression to the mean. You know, your cycle is not the same month to month, and in some people it varies even more widely. So, you know, all of a sudden people are hearing, oh, maybe this vaccine will affect my menses, and now they're paying so much attention to how their period comes out, and well, they're like, oh my gosh, it's different than it was, but you probably weren't paying attention before, so how do you know?
Yeah, it's like when I was writing my piece about the vaccine side effects, there was a study in the 70s on the MMR vaccine that was given to kids, and to see if the side effects were really due to the antigens in the vaccine itself. And so they did this twin study where they took twin pairs, they separated them. One twin got the real shot, and then a few weeks later they got a placebo shot, and the other twin got the inverse, so the placebo first and then the actual shot. And they monitored for side effects. And a lot of the side effects that were reported came after the placebo shot. So they were not due to the antigens themselves. But again, because you have a child, and if you're a parent that just got their vaccine, you're going to be monitoring your child very, very closely. And so you might detect something there that you would not have seen otherwise. And you think, oh, it must be the vaccine. And you report this as a potential side effect of the vaccine.
You know that in the original Pfizer trial, which, you know, involved 44,000 people and divided in the placebo group and the active group, there were actually more side effects reported in the placebo group. which is also, a very interesting phenomenon.
And that's why we do placebo-controlled clinical trials, right?
Yeah. But the thing is that the side effects reported in the placebo group were statistically significant. So I don't know, how do you explain that? But I know that the alternative community, though, in Israel is as strong as it is here, if not stronger. That's not right?
Probably.
Yeah.
Probably.
I would say there's quite a strong community here. Yeah.
Yeah. And of course, there you have the issue of the ultra-religious having totally different views on everything, including health, and they are more at the mercy of the anti-vaxxers, and because the anti-vaxxers will actually target communities that they think are more receptive to their message. And communities that are sort of insulated are very receptive to this message.
Although in terms of the COVID vaccine, I think that the ultra-Orthodox communities are doing quite well.
Yeah, they've done, I mean, first of all, there's been a very high incidence of COVID, given living conditions and living in close quarters. So they've sort of almost had a herd community just from the amount of people who had COVID. But the vaccination drives within the communities have actually been quite successful in the ultra-Orthodox communities here. You were talking about the anti-vaxxers and sort of natural community, alternative community. I don't know. I don't know if you feel this, but like in Israel, it's maybe less militant. Like you can sort of be in the alternative world, but still be okay to take the vaccine. Like there certainly is, anti-vaxxer militancy, but I think there's more of that sort of in between where, you might feel comfortable, you might be very into that world, but still think that the vaccine
right.
is.
I don't think you have.
There's a lot of I think there's also a lot of social pressure here, meaning that people really, take community very seriously here. So this idea that you'll hear people say, well, I'm not sure if the vaccine is the right thing. I don't know. We don't know enough about it, but it's the right thing to do for the community. So I'm going to do it anyway, even if it might kill me.
Yeah. Well, that's the right attitude. But I don't think you have there as many organized anti-vax groups as we have here. Because I mean, here they're militant and they're very well organized. There was an excellent documentary that was on last week on CNN by Sanjay Gupta, and Paul Offit was a recurring guest on this. It was really, really well done, and they focused in on the measles epidemic that occurred 2 years ago in Brooklyn, especially in Williamsburg, which is the ultra-religious community there. And there, the anti-vax group specifically targeted that community. They made up brochures that were delivered exactly nowhere else, just in that community, because they knew that they could have an effect there because there wasn't the balancing opinion from the other side. Mm-hmm. And that of course was just tragic there. That was the worst measles outbreak in fact in U.S. history.
Yeah, they were also. I mean, you remember, Joe? Like I remember I was in the office when this was happening, and we're trying to get the attention of local media down there because anti-vaxxers were organizing this like close quarters meeting to spread misinformation among the ultra-Orthodox community in Brooklyn, and it was just awful. They did it a few times. Yeah,
and it worked. I mean, they scared them enough, but then once the authorities got involved, of course, they managed to put an end to the epidemic because they just legislated that you have to get vaccinated. But also, what was really interesting in that documentary is they talk about just how infectious measles is. Mm-hmm. I mean, far, far more than COVID. And that if you have an active case of measles, and someone is in that room and they leave the room, you can go into that room 2 hours later and be infected. And it's really mind-boggling that can happen. And yet, with the vaccine, measles were on the verge of being wiped out until this anti-vax nonsense started. So, that is what's really scary is that measles almost became a relic of the past until these people got into it, and it could have been wiped out like smallpox. Oh. Anyway, it's really interesting to follow the activities of the anti-vax people and what motivates them. This is also difficult to know what motivates them.
Saving children. Saving children, Joe. Like I'm looking into Robert F. Kennedy Jr., who is probably the #1 anti-vaxxer in the United States, and I just watched his latest documentary, which discussed me, which is called Medical Racism, which specifically targets African Americans with propaganda. There's really no other word for it. And just the name of RFK's organization, it's a Children's Health Defense. And it's all wrapped up around this idea of we are coming to the defense of children, save our children. And of course, there's a link with QAnon, because you remember, especially with Pastel QAnon, it was again the same idea. We need to save the children from these, Democrats, deep state pedophiles, these Satanists, and so it's such an emotional response, right? Our children are being harmed, and we need to save them, and that's what is being used by the anti-vaccination movement. That's what they really believe.
It's
do you think that
interesting.
RFK really believes everything he says? Or
I think so. This is a guy who was, I was curious to know, like, how did this crusade start with him? And of course, he was an environmentalist, he was a lawyer, and he got involved in, a lot of like toxic waste products being released by industry and polluting, rivers and whatnot. And one day there was this mother, she was a psychologist, and a mother who came to his house with a stack of papers claiming that thimerosal in vaccines was causing autism. And thimerosal, of course, is a mercury-containing compound. And she said, "I'm not leaving your house until you've read all of these papers." If this were to happen to me, I think I would be calling the police at that point. But RFK claims that he invited her in, he read the papers, and he became convinced that thimerosal was indeed causing autism. And he went off and he wrote this now infamous piece called Deadly Immunity for Rolling Stone for Salon, in which he took people out of context, he misquoted people, he made a number of mistakes. The article was immediately, they added a number of addenda to it to correct misinformation that he had spread. Eventually Salon took down the piece, and RFK has been on a crusade ever since against vaccines, essentially, claiming he wants them safer, but he's really anti-vaccine. But
this gets back to something we were talking about before, is that you have a mother who vaccinates her child and a few days later starts to notice symptoms that eventually develop into autism. You will never, ever convince her that was not cause and effect. No matter how you roll out the statistics about, incidence of autism in the population is exactly the same as, whether you're vaccinated or not. The personal evidence will always trump everything else. And these people, of course, then become spokespeople. They become very loud because they believe this 100%.
And they get filmed for documentaries like Medical Racism. And so you see the camera inside their homes, and you see the person with autism, and you see the mother testifying. And so these are very emotional stories.
Yeah. Although they had one mother in this documentary, which was very interesting, whose child unfortunately became autistic. And she at first was convinced that it was due to the vaccine, but she was smart enough to start looking into it because she wanted to start an organization to basically attack vaccines. And she started looking into it. And the more she looked, the more she realized that, this link was very, very tenuous and it was not scientific. And that's the only way you can become convinced of the alternate view, is when you do it from the inside. When you start reading yourself and you read widely enough the literature, but that is a
double-edged sword, Joe. It's a double-edged sword, because that is what a lot of people, including RFK, will say: do your own research. But when you're not equipped to interpret complex sort of epidemiological studies, you do your own research becomes an exercise in cherry picking and motivated reasoning, and so you can end up on one side of the.
No, you have
fence
to
or the
know
other.
how to do research properly and what is reliable and what is not, and the people who can do that are rare in the lay community. So this is not a problem that we're going to solve, and it's also not an issue that education solves. I mean, this is something else that we're seeing, that education is not a vaccine against stupidity. There are highly educated people who believe the unbelievable. I mean, RFK is an educated person. I mean, he's a lawyer.
Yeah, he is. No, I mean,
lawyers are educated.
Education can help, but what can happen, like for instance, there's some data that on the issues of GMOs, the more educated you are, the more extreme your position is, and that might be because you think that you're smart enough to figure out what the literature says, and so you can convince yourself of one position or the other.
I mean, do you find that you get arguments from patients, or do they accept what you say?
I mean, in general, or about the vaccine, or sort of in general?
Just in general.
I mean, I think in general, most people are on a day-to-day basis. You don't get too many questions. You might get some, questions about, is this, why this antibiotic? Can I wait? Can I this? Can I, that kind of stuff. But when it comes to, sort of the central part about the diagnosis or medication, I think most people are on board. Although it always reminds me of that one story when I had a patient come into the clinic who was having an acute heart attack, acute MI, was having a middle of a heart attack. And I said, we have to transfer you to get an angiogram. You're having a heart attack right now. And they said, well, is there any natural thing I can take instead? Do I have any other natural alternative? And I sort of looked at him and I said, well, your untimely death would be a possible natural alternative that we'll try to prevent for you. But in general, I would say on a day-to-day basis, it's, that's sort of a rare story.
David, have you tried Reiki against acute MI? I hear there's some anecdotal evidence that it might work.
Haven't tried it against much else either, but I'll be honest.
But there's all this controversy now over stents, and that they really don't solve the problem any more than doing nothing.
That's interesting. I have to look at that more.
Yeah. I don't know about stents specifically, but yeah, there's this whole idea of that there are many medical practices that have never been thoroughly tested using clinical trials, and when you do test them, you sometimes find out that they do no better than placebo, and so that's important to keep in mind.
Well, also, and we shouldn't sweep the placebo under the carpet. I mean, placebo can be very beneficial, right? I mean, if you're not dealing with a heart attack, but I mean, you're dealing with the usual, the self-limiting conditions. I mean, if you believe that taking, clover leaf extract, whatever is good for you, and you feel better, fine, as long as you're not, being distracted from legitimate therapy for some serious condition.
But that's the thing, and that's, I mean, go ahead, Ada, but it is an ethically slippery slope.
I was going to posit to your old article showing that complementary medicine almost inevitably becomes alternative medicine. Yeah.
There was a study that, because you have these two things, right? Alternative medicine is an alternative to medicine. Complementary medicine, you use it on top of the medicine. And when it comes to cancer, sometimes a patient will need, surgery, radiation therapy, and chemotherapy. And unfortunately, when a lot of patients were reporting using complementary medicine, what it turned out to be was an alternative to medicine. So they would still do, let's say, the surgery, but they would refuse the chemotherapy and they would take homeopathy instead. So, I mean, I get the point that you're making, Joe, but it's too often, it's if you're an alternative medical practitioner, you often think, because a lot of these practices, they imply a universal boogeyman and a cure-all, right? Every disease is caused by this thing. It's a misalignment of the spine. It's your chi that's being impacted, whatever it is. And my technique that I use is a cure-all for everything. And so it's very hard for these people to just say, well, the only thing that I can do is slightly improve your mood a little bit. So there's always this push towards doing more for the patient and drawing them more and more in. The journalist that I was speaking to, he did this Zoom session, this Reiki Zoom session for stress or whatever it was. And at the end, the Reiki practitioner told him, said, "Am I all right? I think you suffer from lower back pain." And the journalist said, "No, actually, I don't." But then he started to think, well, do I? Maybe I do.
I mean, who doesn't?
Yeah, and I was telling him, well, I said, it's quite interesting because either this person is deluded and they think that they can read your aura, your chakras, or whatever it is, and she thought that she could see this, or it's like cold reading with psychics, and the person thought, well, who doesn't have lower back pain? It's one of the most common chronic conditions. So I'm going to try this because if I hit the jackpot, then I can offer more treatments for his lower back pain, and then maybe there's something else. So it rarely sticks with the one minor ailment. They always
well, another technique they use with the back pain is say, well, you're suffering from back pain, right? And you say no, and they'll say, "Oh, great, we caught it just in time because you would be suffering from back pain,
right?
If you don't do this treatment."
Yeah, heads I win, tails you lose.
No, they can be very, very clever. Sometimes you have to give them begrudging credit for that. They're very good at what they do.
Yep.
All right. Well, I think we've kind of run out of time here, but it's been a very interesting conversation. And glad to hear that you guys in Israel are getting back to whatever normal used to be. But I mean, you're still wearing the masks, right?
Yeah. Interestingly, after all that, I mean, they're talking about changing the law, but even with everything, the law still states you have to wear a mask outside. So we're still wearing masks outside and inside, according to the law. Although the government's talking by the end of the month to at least stop the outdoor portion of wearing it, like needing to wear a mask outside.
And you can breathe just fine, right?
So debatable, apparently. It's not summary yet. Yeah.
What is the projection for getting 70-80% of the public vaccinated?
I think once they lower the age, once they get the 12 to 16-year-old cohort vaccinated,
that'll be exactly.
I think we'll hit it. Once
they're doing studies and they're talking about starting to vaccinate 12 and up, 12 to 16. That'll hit a big portion of the population.
And you're not hearing that much there about the variants.
The variants, I think, very much. Well, first of all, it's still very hard to get. Even we say we're going back to normal, but it's still quite hard to get into the country. I mean, you still not as hard as Canada. Which I've been back in a long time. With the hotels in Canada and all the rules there. Here, if you have 2 vaccinations and you prove it and you have a negative test, you don't have to do the whole hotel isolation
but
thing.
They're not letting people in.
But they're still not letting people in general. It's still quite hard. So that's stopping. And also, once you vaccinated a certain percentage, I mean, mutations happen as the virus infects people. That's what causes it, right? That's what makes it mutate, right? As you get more and more infections. So once we've already had the vaccinating 60+% of the population, so that also decreases the chance of having more mutations and variants.
In Israel, but of course it can still mutate in other countries where.
Of course, I'm talking about locally, sure. Yeah. But again, we say normal life, but still, getting in and out of the country still is still a challenge.
But the ICUs are not full.
The numbers aren't. It's again right before this whole vaccination drive started. It was getting actually pretty bad when we had those 10,000, 11,000 cases a day. They were transferring patients from the Tel Aviv area to the northern part of the country because everything was full. And then you just saw a dramatic change after the vaccine drive.
Yeah, well, here we saw the drop, but now it's going up again. Anyway, all right. Well, thank you everyone for that stimulating conversation. And it's always good to get the news from halfway around the world. So we'll check in again sometime within the next few weeks, see how it's going there, and hopefully we'll have better news from here. So that's it for this little edition of A Dose of Science, and we'll be back with you in 2 weeks' time. So thanks for the whole crew, and bye everyone.
Bye. Thank you. Thanks for coming on.
Bye.